Okay.
All right. Thank you very much. Thanks for coming. Welcome to Minnesota. Especially if you haven't seen our beautiful state and city previously. The weather's always like this. When you hear about storms and cold weather, that's just all made up. It's beautiful here, as you can see. So the topic today, as Mark said, maybe I have to use this.
No.
There we go. Sorry. Just to introduce myself a little bit, so I'm a veterinary pathologist in academia. I do require imaging, and make sure at some point we turn up the spotlights. Okay. Figures for manuscripts and grants, teaching, and I do some consulting, so for those pathology reports I need images, and those need to be high quality. And this, my schedule for imaging, I don't do imaging every day or every week. I can have 6 weeks go by, and I do no imaging, and then all of a sudden I'm on an emergency to get images. And it's been, stressful because I am not an expert at imaging. I'm just not. So when I need those high quality images, I've had some issues. I'm not an expert at using Photoshop. I took a week-long course, and what I learned from that is you can take the worst image on earth and make it perfect. You really can in Photoshop. If you know, they went through all those steps how to do that, and then it's exactly, my analogy is an advanced Excel class, and I'm just amazed what Excel can do. And I mean to get back to my office and use it, and 6 months later, I can't even do anything in Excel. So to me, Photoshop is that way. I don't use it regularly, and I'm just not good at it. So I needed a simple, reliable system to produce high quality images that requires that little or no editing. And especially if you have a calibrated system like this one, it doesn't rely on me saying, a little more blue, a little more red. It's calibrated, so it should represent the actual either gross specimen or microscopic image. I will say I'm not an employee or anything to do with CHROMACAL. I'm not paid to give this talk, or they asked me to give a talk about my experience with the system, and I'm happy to do that. But there's no conflict whatsoever, so I'll just tell you. So background information, this is a color calibration system. It's meant to provide an accurate representation of the specimen. So sometimes I'm thinking, well, the image looks a little blue or whatever. No, I look in the microscope and that is what I'm seeing, which is what it's meant to do. It provides consistency between images that you're not going to get otherwise. And on the computer monitor, especially once you calibrate your monitor, you have accurate color rendering. A caveat here, I didn't really plan for a projector that, this system is going to be, I wish it were a little better, because looking at some of my slides, I can see that it's not the same as on my computer at home, where I'm seeing really striking differences, and this projector system kind of is going to falsely make things look not as good as they could. So I will just say that. Standardized color, we'll talk about a little later. It allows optimization of thresholding. In our lab, we do automated histomorphometry measurements, and this allows that ease of thresholding, and it ensures consistency among the image. No compromise to the actual data from the image, and more consistent thresholding through the sample set. So those are some of the words. Have any of you used this before? Okay. This is how simple, and Mark is actually going to demo how to do this too, but basically you have the, provided with the system is a calibration slide with colored dots in the slide. Yeah, you capture an image of that, save it on your desktop, and then you take your images of your sections. And then later, and it can be next week, next year, or 2 minutes later, you pull up the images. You can either do them one at a time, or you can batch. You can put them all in a folder and do the entire folder full, and it's fast. It's a very fast system. So you pull up your calibration image, you do a couple steps to make it linear, which Mark will show, and then you just say apply to the images, either the single image or the entire file, and there you have it. And I'll talk a little bit more, and then you evaluate. And it shows you immediately what your previous image and your calibrated image, you can see them side by side. And I think maybe I'll do just 2 more slides and then let you do this demo. So just hang on to this thought for a minute. So it saves both the original and calibrated slide, and the calibrated slide, the file name is modified, so it lets you know that that one's calibrated, which is nice. So it saves them both. And you can put them in different folders or whatever. I just put them all in the same folder. You can batch groups of images and calibrate all at one time. That session you can do at any time. And you do, though, need to, I adjust for color illumination every time I use my microscope, and Mark just told me that the white balance really is taken care of by CHROMACAL, so I think just use your best standard practices for microscopy. That's what that's meant to say. It won't solve, terrible problems. If you've got a really, uneven illumination, it's not going to fix that. You need to start out with high quality. And that, so then I'll just let you.
Okay. Thank you, Cathy. So just quickly, I exit out of this. So CHROMACAL will give you this to begin. I'm just going to show you how quickly we could do a batch process. That's really the workflow opportunity that you have. So I'll open an image of the calibration slide. And this is what it looks like when you begin. You want to put a box in one of those color patches. So as Cathy mentioned, this you take an image of this. That image is the color fingerprint of that imaging session. Okay, so subtle things change, but they can contribute to huge swings in color. If you're using a halogen system, a slight change in voltage will actually give you that. And white balancing won't necessarily correct, so this is where CHROMACAL comes in. So I'm just going to click and zoom across here. You see those boxes turn to blue. That tells me I'm aligned. Cathy mentioned linearity. What we're doing is measuring these neutral patches here on the right. We could take a look at that, and you can see that yes, my system or this image is linear. And linearity is important for comparability and also predictability. So you can see we've got nice straight lines here, so we can do a lot of work with color and segmentation if you're doing analysis. And then I will do a batch process.
So before you do that, maybe we just mention this often when I do it, it comes a bad, and then you have to move these squares around, and when these all say good, then you're good to go. So since he's not showing that, poor. It's not bad, it's poor.
And exposure, the bottom one is looking at the white patch. You want to make sure that you haven't saturated, because if you have white, you've got saturated pixels, you're losing data. So it's just good practice. Anyway, so we'll do a batch process.
So do you run the calibration slide each time you take images, or is it once a week? Is it once a month? Is every time you?
I recommend every time.
Okay.
It's good practice. Do you color every time? Should you color every time? It's the best practice is yes, do that because of the subtle differences. Whether it's a phase of the moon, I don't know.
The other thing is the unpredictability if any adjustments have been made on the microscope system from day to day. So if you capture that fingerprint before each session, then you're guaranteed that there's a match of that profile to all the images that you're going to calibrate in the same session.
But that's simple to do, just one more image.
So what I'm going to, I picked a folder called raw images. I'm actually going to save the calibrated images back into the same folder. We don't overwrite the originals. Like another good practice. So you can always go back to the original and refer to it, and you can also turn off things. This is just another calibration slide image. But as Cathy was showing here, you can see before and after, left and right. But really, the beauty in this is just being able to process those images in a batch. Something that you don't have to do. I don't have to open up each one and white balance in Photoshop or adjust saturation or brightness. CHROMACAL takes care of that for you with automatic white balancing and brightness matching between images. We're now done. And I will go to, where's my folder? All images. I'll just show you that they are in here. Okay, so you see the before and the after of each of these in there. And then just one more thing I want to show you is in the viewer, what we're able to save with our calibrated image is the details of what happened for that calibration. So here's a before, here's the calibrated, and it's difficult to see because it's off the bottom. But there is information here saved in metadata with the image regarding that. So if there's questions, it's not always about was this processed? Yeah, of course it was processed. It was processed to it based on standards. So there's a lot of reference information there. So, okay.
I know in GLP the raw data is the slide itself, but have you had any problems with this with GLP?
GLP for non-clinical, just it needs to be mentioned as a system that's being used. But for clinical, it would have to be validated for that. We do have customers who are veterinary pathologists and consult and do submit calibrated images along with the originals to their clients, and in which are included in dossiers to the FDA. So, okay. Go back to our presentation.
Okay, and most of the rest of my presentation is images. I don't have that much more to say. So I've got some gross images and then a microscopic taken on several different systems just to show you my experience. And also the color and focus with this projector is just not as good. I guess I can't do anything about that, so that's the last time I'll mention that. So Jackie Dykstra is one of our new pathologists. She graduated from Alcian State Veterinary School and did a PhD in her pathology training at Minnesota. She was hired at the end of May, and in her startup package, she requested the CHROMACAL system, both for microscopic and gross imaging. So now we're set up for gross. And she took some images and, you know, I'm showing you the before and after on gross, which at least on my monitor are hugely different. But so this is just so you know, the camera system she used, and she took these each on different days. So they weren't taken all in the same session, and then she post-processed back in her office whenever. She did, if there was a black background, she edited to make sure the background is uniformly black. That's all she did. So she did no other editing on these other than the CHROMACAL adjustment. All images taken on different days. And she took something blue because she just said we don't see many blue things at gross necropsy. So their first image is blue jay feathers. So the order of these, I'm going to show you the unprocessed, then CHROMACAL processed, and for the gross, I'm going to have the original image down in the lower right corner. So this is unprocessed, processed, and there's the original. And maybe in this one, you can see it just, for me, it just kind of lightened up a little bit. This kitten, which, you know, it's a beautiful image. The colors, just to me, become much more vibrant. And yeah, I think even here, better on my computer. But here's the original, here's the processed. Feline lung, and this is not meant as a gross exam, so I didn't even ask what, you know, lesions. They'll look at the different colors and different specimens. So here we go, feline lung, there's the processed and original. Canine renal hemangiosarcoma. The processed came out, I thought, somehow it's just too bright. There is an adjustment on CHROMACAL to decrease the saturation. So I'll show you. Here's the just regular CHROMACAL processed. Here's the original. And I went and now it's looking a little more purpley to me, but I decreased the saturation because it was so bright. But that's how that one came out after CHROMACAL. And these, again, this is the original equine lymph node, which is so striking on my computer, and I'm not seeing it at all here, but unfortunately I think that's the system we're using here. Of course I know variant mass. It's just here, just the images look a little brighter, but the color actually changes in these images if you're using at least a calibrated monitor. And this image, I think it's one of the worst. I mean, it's just not a very good image, not a nice background. It was a little bit dark, bone marrow from an alpaca, and the calibration really makes that, to me, a quality image. And this is one of my favorites, snake skin, why she did this again. She was trying to get different colors, different whatever, and here's the calibrated. And that one, I think for sure you can see that the colors kind of come out. That's the way I guess I describe it. Cat lung with neoplasia. So uncalibrated, calibrated. Those are gross. Any questions on the gross images? If not, we're going to go through routine histology. I've got a bunch of special stains. I've got immuno, and we're just going to kind of fly through images, which I hope, as pathologists, you will enjoy. This is something I enjoy. So the first ones were taken by Jackie on we're using an Olympus microscope and an Olympus digital camera. And I say what the specimen is, and the mag, the stain. These first ones are all H&E, and I'm just going to show uncalibrated and calibrated. And I didn't go through because there's about 100, and for time, I'm just going to show uncalibrated, calibrated. So here's uncalibrated, calibrated. I guess in some of these I actually did. Here's the uncalibrated and the calibrated image. Horse lung at 40x. Dog rib at 40x. This is uncalibrated. Calibrated, which Jackie felt she wanted to reduce the saturation some. She decreased in the setting. You can see what the setting is when you do that. And I think that if you compare, it really goes more the purple versus pink, if you will. Another H&E. So those were the H&E images that Jackie took. Then we took some, either I did or in our Cancer Center core lab we both setups are Nikon E800s and Spot Insight cameras. They're different versions of the cameras, but just to show, and this was taken in the Cancer Center core lab with colon, polyp, and there's the calibrated image. Wanted to show some background, and so you can see what it does to the background, because most of my histo images are higher mag rate on the specimen, and this shows uncalibrated next to the calibrated image. I should have mentioned too, this doesn't improve staining. If you have a really bad quality specimen, it wasn't stained well, your image is going to show a specimen that isn't stained well. It's not going to do it. It's going to produce what you're seeing through the microscope. So you do have to have high quality material. This is one I took, a nose artery from a mouse, and there's the calibrated image on my system. You can have the date of the calibration that indicate that it's calibrated on the image, or you don't have to do that. Once you save the image, you can't remove that, I guess, unless you would crop your photo. And they're uncalibrated and calibrated. And now I've got a series of special stains, and Jackie is interested. She is, one, she's brilliant. Two, she's an expert at Photoshop. She's very skilled at imaging and interested in imaging, and she wants to do a project where she does the CHROMACAL adjustment and Photoshop and kind of compare. She's working on a little project for, I think, just a presentation for our lab. So she went through like all our special stain controls and imaged them, and then used the CHROMACAL adjustment. So she imaged them over, I think, 3 different sessions, and color calibration she did in batches. I think she saved in folders, then did those in batches. So here the acid fast. You certainly can see that the color changes. It doesn't just brighten up the image, but it brings out different colors. Alcian blue. You know, on my monitor, the originals are really dark and the chromacals look great. On this, the originals to me look pretty good and the chromacals look overexposed, and I think that's this system. So again, it's not, see, this was a really dark image. And it just, maybe with this projector system, to me looks a little bit too bright. So if you're noticing that, that's not what I was seeing before this morning. Cresyl Violet. Gram stain, I really like this system on gram stain. I think you can see the bacteria better. So here is the uncalibrated and calibrated, and later we've got a gram control with a lot of bacteria, and if you go back and forth between those, you can identify the bacteria more easily. The Elastin, and this again on my monitor was a very dark image, and just kind of beautifully both illuminated and the colors come out. I can't think of a better way to say it. Giemsa stain, so we're seeing mast cells with the granules, and there's the calibrated image. Am I going too fast or too slow or just right? Is it okay? Okay. GMS, calibrated image. Here's the positive. So the gram stain positive control is both positive and negative bacteria. And this is the calibrated image, which again, when I'm sitting at my computer, I just can visualize the bacteria much better. Part of it is an illumination difference, but also I think the color is distinguished better between the gram positive and negative. Jackie felt this one, I think, was a little bit too bright, so she backed off on the saturation. To me, it didn't make a huge difference, but she preferred this. So on a couple of these, she changed the saturation. Otherwise, it's, and that's when you're using ChromaCal and you can see the original and the adjusted, you can change it right there. So you can see how the image changes. You can change both contrast and saturation manually before you save that image. An iron stain. And this is an example of a really dark one. Lux Sulfast blue. And this is kind of more the type of changes I was seeing using my computer. Another Lux Sulfast blue. Mucicarmine. PTAH. Picric acid, I never use this stain, but I love this with PTAH, and this is collagen, and you really can't see the cross striations in this image, but maybe you can, boy, I can see them so easily in my computer. I think the focus just, yeah, see up here? When I look at this on my computer, the cross striations kind of leap out at me. They're much easier to see with the ChromaCal processed image. Reticulin stain. Steiner, again, for bacteria. Trichrome, which I use a lot. And Bancasa. And so just to show you, I've got a few special stains that I took the images on my microscope, just a different system, and then once I'm done with those, we'll see if you have questions on the special stain portion. This is oil red O, and I know this is mouse aorta, showing the athero lesion, and so this is the uncalibrated, there's the calibrated, and this time I'm showing side by side, so you can see uncalibrated, calibrated. You certainly can see a difference in color. And the question, I didn't actually realize that I should be imaging the calibration slide at every session. I haven't been. I've been using one that's saved on my desktop. So I'm going to go back and do that. I just didn't, it makes sense to me now because I'm not sure, sometimes I change even the neutral density filters. Maybe some of those changes are affecting the color and I should be standardizing it with each session. I have not been doing that. Another oil red O, side by side. And then I go to immunohistochemistry. Are there any questions with what you're seeing on the special stains? I think it just provides a nice variety of, you know, different colors and stains with or without the CHROMACAL calibration. So for the immunohistochemistry, again, we use two different systems, an Olympus BX45 microscope and an Olympus camera, and Jackie Dykstra took these. There's just a couple, I think maybe one, CD3 positive control. I'm gonna just go back and forth. Quite a striking difference, and I think, as I'll mention later, if you're doing thresholding, it's just easier to do consistently on these calibrated images. That's our impression. I guess we haven't tested that. These are some, I think I took these, this is the 800, no, Josh Parker, who is our technician in the lab, took these images with the system in the lab. It's a Nikon microscope and spot insight camera. And this is CC10 is the antibody. It's lung. This is the uncalibrated image and the calibrated image. And beta-catenin and GI tract, uncalibrated, calibrated. Got a couple of these. These are higher mag images. So each camera microscope system is a little bit different, but the idea is the calibration provides consistent images to represent what you're seeing with that system. These I took a couple CD31. This is a mouse aorta showing the plaque and macrophages, and calibrated image. And in these case, it's stamped on there so we know, and uncalibrated to the left, calibrated to the right. Just another one. This is the same mouse aorta, uncalibrated and calibrated. And to me, just the color is more, I don't know, crisp, bright, colorful, something, describing just subjectively it looks different to me. So after Jackie had done this, I just immediately before this meeting, like a day ago, I emailed her and said, do you have any comments on your experience so far? She's only had the system, well, she only started the end of May, so she's only been using it a month or two. And, what do you think? And she didn't know I was going to do this, but I just took her direct quote, and she said, in general, she said, the CHROMACAL program accomplishes exactly what it sets out to do. For some special stains, I think it can start leaning a bit more blue than my eyes say is real. She said, for example, the Cresyl Violet, but she thinks it does very well with the H&E. She hasn't used it much for macro, but she likes the results so far. And from a research standpoint, knowing she could bring all the images to the same color standard in spite of different lighting conditions on different days is a plus. So those were her comments. I asked Josh also, because he does the automated, threshold and image analysis, and he said it allows us to standardize the colors of the raw images, and they allow us to better optimize the thresholding capabilities without compromising the actual data. That's your concern with the thresholding. What are you actually measuring? Because the system will measure whatever you kind of tell it to measure, but you want to be accurate and consistent, especially in a group of specimens. You take care that they're all stained on the same day, they're all treated the same. This allows you to obtain that data, I think, more accurately. So he thought the threshold was more consistent, and some of these things are subjective, but he's been happy using it. And that kind of brings me to the end of this, because we wanted to make sure there's plenty of time for questions. Jackie Dykstra provided a lot of these images. Josh Parker was a great help also. And I wanted to show you images kind of from multiple setups, multiple different people, so you could see the kind of consistency that we're getting. So far so good. Again, I'm not a paid representative or not, but we have been happy with this system. So are there questions that any of you have in particular?